Instability testing is used for patients who've given a history of dislocation, or young patients who give a history of pain or clicking in the shoulder, or patients who give a history of feeling as though the shoulder wants to come out of joint in certain positions. I test for anterior instability, posterior instability, and inferior instability. I also would do a Baton's score, and I have another video that shows how to do this. For anterior instability, you want to stand behind the patient. You put a hand on the patient's shoulder to reassure them. You bring their arm up into 90 degrees of abduction with the elbow at 90 degrees, and you externally rotate them, looking at the face for flinching, feeling with your hand for any muscle spasm, or looking out for any pain. At any of those 3 points, you stop the examination, and that's a positive test. If in this position the patient is still comfortable, you can push them into a further position of instability by raising the abduction above 90 degrees. To test for posterior instability, I put a hand behind the scapula to stabilize it. I keep the elbow bent at 90 degrees and bring the patient into neutral adduction, and I load posteriorly on the posterior labrum, looking for any sign of flinching, posterior pain, or muscle spasm as a positive test. And for inferior instability, we look for the inferior sulcus sign. So again, we support the arm to reassure the patient and pull downwards on the arm, and we look for a sulcus to develop under the acromion.